back on the Health Watch this morning. This week is National Infertility Awareness Week. As infertility care becomes a hot button issue, this year's theme is Leave Your Mark. From egg freezing to IVF treatments, there's a wide range of options now available for those looking to conceive and build a family. And joining us now is fertility expert Dr. Asmia Ahmad, correct?
Ahmad, yes.
Asmia Ahmad, thank you so much for joining us. She's the founder of Carrot Fertility, a fertility, healthcare, and family-forming benefits provider for employers and health plans. We really appreciate you being here. This is a topic that's so important to not just women, but men, families in general. So according to the World Health Organization, about 1 in 6 people worldwide are affected by infertility. That's a lot of people.
It's a lot of people.
So what exactly is infertility, and what are the options available for those people who are affected?
Yes. So infertility, the historical definition has been that it's the inability to get pregnant after about a year or longer of unprotected regular intercourse, which is for heterosexual couples. And now this definition is expanding over time. Like the American Society of Reproductive Medicine changed it in the past year to be a little bit more inclusive. So for all people who are doing fertility treatment or may need to do fertility treatment to grow their family, maybe using donor egg or donor sperm or working with gestational carrier, that way you're also including single intending parents and same-sex couples who might be trying to grow a family. That's something that we've always done at Carrot Fertility, inclusive to all paths to parenthood, including people who might want to grow their families through adoption as well. Now, in terms of treatments, there are many. I think the one that you hear about the most is IVF, but there are things that you can do before IVF. For some people that don't ovulate regularly, for example, they may take medication to help them ovulate more predictably, or even something called intrauterine insemination, where you might take a person's sperm and put it directly in the other person's uterus to help them get pregnant. So there are different options available, but IVF is the one that you hear about the most.
So Dr. Ahmad, say you are just curious about your fertility, and maybe you're not even trying to have kids right now, but you're still curious. What options are there for you? What should you be exploring?
To start, I'll say it's never too early to learn about your fertility.
Of course.
I think that's something that we should be taught about in sex ed when we're in junior high. So maybe please add that to the educational program. But I do think that there are, different ways to seek out information about your fertility. For example, for someone who might be on our platform, there's a lot of online educational content. You can talk to experts around the clock, including reproductive endocrinology and infertility specialists. But for others, the first conversation may be with their OB-GYN or maybe with their primary care physician, and from there they can initiate initial testing, talk to you a little bit about how to time ovulation and how long does sperm last inside the female body to make sure you're having intercourse at the right time. But also there are at-home testing available, and I mentioned that because a lot of people are starting to utilize that because of the convenience of being able to do it from the comfort of your home. But one thing that I'll add is it's really important to look at the company and make sure that they're working with a reputable lab, and also that you're talking to a doctor at the end of the day to really understand what those results mean, because it's not going to be a copy paste of what one result means for one person to somebody else, right? It's not a one size fits all. You want to make sure that you have a personalized discussion on what those results mean.
Yes, of course. And typically when we talk about infertility, people think of women, but as you're saying, it's not just women here. Men are also affected by this.
Absolutely. About 40 to 50% of cases have a male factor component, and even with our Carrot Fertility members, 40% of our members are male. And so it is really important to remove that misconception that it is just a woman's issue. It affects both men and women.
And so we want to talk about employers out there. Through your work with Carrot, what are you seeing as far as employers are responding to this need for, basically fertility treatments? The very many options that are available. Employers basically now are helping out in their own way as well.
Yeah, they are definitely trying to help out. I would say when we first started the company, we were doing a lot more education on helping employers understand the value of fertility benefits and just how many of their employees it would help impact and improve access of care too. But now we see employers reaching out proactively. I mean, there's such a difference between then and now. And I think part of it is things like National Infertility Awareness Week and, and like Carrot Fertility, making sure people understand how many people are affected by it, how many people need to access that treatment, and also that financial is a very large barrier for many people because it can be $20,000 to $30,000. I will say for our our customer base from 2020 onwards, we've been seeing doubling, and we have people that that we work with, for example, the employers that are of various different backgrounds. So they can be automotive, manufacturing, retail, financial companies. People usually think it's the tech companies, but now everyone's looking to help support their employees because they want to recruit and retain that high-level talent and show their employees the support.
Yes, and it is great to see the progress out there.
Yes,
Dr.
absolutely.
Asmia Ahmad, thank you so much for joining us. We really appreciate it.
Thank you for